Hey guys, it's Dr. Andrews. I'm going to show you how to do an abdominal GI assessment on your patient today. So I have already washed my hands really well and I'm going into my patient's room now. Okay, so the first thing that I'm going to do is walk in and introduce myself. Hello, Miss Jill. I'm Chelsea.
Hey.
I'm going to be your nurse today and I'm going to be performing an abdominal assessment. Okay, to maintain my patient's privacy, I'm just going to pull down her covers so I can get to her abdomen, and then I'm going to lift her gown here. Okay, remember, for the point of this summer and for the video, we will have your clients that you're assessing covered. But when you get into the hospital with us this fall, we will actually lift the gown so you can see her abdomen. So first I'm going to start off by observing her abdomen. So I'm just looking at it, and when you look at the abdomen, you want to look from the top and then you want to come down and look from the side. And so I'm just observing it, looking to see if I see any the shape of the abdomen or the contour of it, and if I see any peristalsis or abnormal pulsations. Okay, then I'm going to come up and I'm going to inspect the abdomen, and I'm just looking to see if I see any scars, lesions, the vasculature, or any bulges like a hernia on her abdominal area. All right, so remember, with the abdomen, the next thing I'm going to do is I'm going to auscultate. Okay, we don't want to palpate next, we want to auscultate. So I'm going to put in my stethoscope, and I'm going to use the diaphragm of my stethoscope for this portion. Okay, so I'm going to make sure I do each quadrant for 15 seconds. And for the purpose of this video, I'm not going to stay 15 seconds, but you would listen for 15 seconds in all 4 quadrants. And you'll see on your checkoff sheet that this is a critical skill, so make sure you're doing that. While I have my stethoscope, I'm then going to flip it over and change to the bell, and I'm going to listen in her epigastric area to see if I hear any abdominal bruise. Okay, and I did not, so that's what I want to see. And then lastly, what we're going to do for the abdomen is we're going to palpate. We're just lightly palpating. So it's better to use the fingertips, the pads of your fingertips to palpate. And some patients are ticklish, so you kind of have to work with them. And so when you're lightly palpating, you're just pushing down about 1 centimeter going around. And while I'm feeling, I'm just seeing if I feel any masses. And I'm also going to ask the patient if they have any tenderness. So Miss Jill, do you have any tenderness when I'm pushing on your stomach? Good. You would also look to see if there was any guarding. So guarding would be as I'm pushing the patient coming up and kind of guarding their abdomen. Okay, and that's it for the abdominal assessment.